Welcome back. I'm Christine Cartwright at Central New Mexico Community College with your second lesson on CNM Glass of Medical Terminology. Make sure you have your index cards and let's get ready. The first term we're going to cover today is oid. O-I-D. Oid. Oid means like, but not as in I like something, more like it is similar. So we're going to be looking at discussing that things are similar, that they're like something else. On your next card is osis. Osis is an ending that you're going to hear behind words, and it really means any condition involving that root word. Our third word is lysis. Lysis means to loosen or destroy. So today as we discuss some of the words, I'll try to bring these in, but you're going to see us use these more throughout the semester as combining forms. So if you look at your words from last week, you can put like nephr, if you remember nephr was kidney. Nephrosis is just any condition affecting the kidneys, of the kidneys. So it's a very generalized, vague type term that needs to be drilled down further. Often you'll use osis when they're sure there's a problem with something, but maybe don't know the exact issue yet. So let's get started with our more common root words. And the first one is lipe. Lipe, turn over your card, means fat. A lot of people are interested in loosening and destroying fat. And if you're having trouble putting lipe with fat, think of the times that you've seen lipe in lipids, right? In your fats. How about liposuction? We are definitely destroying fat with liposuction. We're suctioning the fat right out of you. The next card is glyco. Glyco, if you flip it over, means sweet. So glycogen is the form of storage in your muscles of carbohydrates. You can think of glucose to help you remember glyco means sweet. Really, when our muscles are using our calories, they undergo the process of glycolysis, and you might have heard this. All right, our next card is necker. Necker means dead. So in NA, you probably talked about bed sores. In here, you will talk about that again, decubitus ulcers, repositioning patients. But one of the things we see around some of those bed sores is necrosis. It's any condition of being dead, and it's that tissue that's dead around it. So you'll hear someone talk about tissue necrosis or necrotic tissue being present. That is dead tissue. Your next word is sarc, and that means flesh. All right, new card, carrot. This one's actually interesting. Carrot means horny, as in having horned type tissue. And I know probably during your rotations into assisted living or nursing homes, you took care of the elderly with that horny, scaly skin. It might have been on the top of their ears, the back of their hands. That's called actinic keratosis. Any condition of having horniness. So there's a horny hardness to the skin and patches that grows there. It's pretty prevalent the older you get with sun damage. All right, our next word is mile. Mile means marrow or spinal cord. This is a very squeaky marker today. With mile, I think one of the places you may be familiar with it is someone who has leukemia. So if you've heard of leukemia, there's a couple of different kinds of leukemia, but myeloid is a type of leukemia where it's in their bone marrow. So remember, our bone marrow is what makes our blood cells. So we know myeloid, it's like or similar to a marrow disease. They're telling us it's coming from here. Our next word today is cyan. Cyan just means blue. And how many of you, when you're doing vital signs and you learned in NA class to take the oxygen saturation, and you talked about cyanosis, right? Any condition of the patient being blue. Their oxygen level is not high enough. They're turning blue. They are cyanotic. They have cyanosis. Our next root today is blast. And blast means bud. You're going to hear blast with oid, and when I get to the cancer words, sometimes you hear blastoid type cells, bud cells. And when you think of this, buds are things that are getting ready to grow and bloom. You'll also hear of osteoblasts. That's what causes bone to grow. They're those budding cells that are adding new bone. So blast is a bud. Our next word is aden. Aden means gland. Have you heard of adenoids? So if you've ever had a tonsillectomy or know someone who had their tonsils removed, perhaps they also had their adenoids removed at the same time. It is a gland-like structure beside the tonsils. So adenoid is probably a word that you've heard that you didn't realize was made up of two separate meanings. Aden means gland. Here's one that you're going to be dealing with frequently, and that's heme or hemat. Heme or hemat refers to blood. So heme, and remember from last week, hemat, put it with your card from last week, ology, hematology, the study of blood. A hematologist is the doctor who specializes in blood disorders. So hemat is blood. I think when you guys are in phlebotomy, you also discuss that there are different departments that certain tubes need to be sent to, and that becomes important. All right, new card. Let's try the word hypno. Here's a word that you've heard a lot, perhaps over the years. Hypno means sleep. What if I put hypno with osis? We have hypnosis, any condition that looks like sleep, right? So when someone is hypnotized, they haven't fallen asleep, they're in a sleep-like state. It's any condition that appears to look like sleep. So whether you believe in hypnosis or not, that's where that comes from. All right. Our next word is I'd like to go one time without having to erase something. Thromb means lump or clot. So in one of your lectures here as a patient care tech, we're going to be talking about preventing thrombosis. We're going to be talking about preventing blood clots, any condition of having a lump or clot. Thrombosis especially when we get to pulmonary, is an issue that we really don't want to have to deal with in the hospital because it's deadly, yet all our hospitalized patients are at high risk for developing these thrombosis, these blood clots. Our last word for today is psycho. Psycho just means mind. So you hear, people are psychotic. We don't use it exactly as its root goes, but think about psychology. So if you put psych with your ology from your last lesson, you have psychology, the study of the mind. You have a psychologist, the specialist who studies the mind and helps people with issues surrounded here. You have psychosis. Sometimes when a patient is coming in and things aren't right, initially we say they're in the state of psychosis until the doctor can then further diagnose exactly what the problem is. They just do have a condition of the mind, but we don't know what specific disorder it is yet. Okay? So with these words, you're going to take your endings, you're going to take your words, see if they make and form new words, as well as with your cards from last week. Take a minute to play with them, to put them together. I gave you some examples today like hematology. Not every word will go with every other one, but this way you can see they start to form. I will point out mile again. And I want to point out, maybe it was on the last one. I was going to point out nerve, but it was on the last one. Mile, remember how we had itis last time? Myelitis, inflammation of this spinal cord, kind of goes along with that encephalitis as well, and West Nile virus. So when you get those inflammations, you have some issues. So play around with these. You may need to, on ones that don't automatically mean something to you, you may need to come up with a way to remember by drawing a picture, by making a phrase on the back of your card so that when you flip, you remember what it is. So this was a shorter lesson, a little fewer words, and next time we'll explore a whole new set.